the FOX6 studios, this is Ask Contact 6, and this is the segment where we bring in experts to answer your questions. Today, our topic is healthcare systems, insurance plans, and medical bills. We chose this topic because these are issues we hear about constantly at Contact 6, and we know how important it is to find appropriate, effective, and affordable care. So to answer your questions today, we have two experts joining us. First, we have Debbie Deutsch. She is a patient advocate and founder of Patient Care Partners. Debbie, thank you so much for being here.
Thanks for having us.
Oh, of course. And to help answer your questions about medical billing and health insurance, we also have Sadie Tischer with us. Sadie is a health independent insurance broker and the owner of Wisconsin Health Insurance Advocate. Thank you for joining us as well.
Thank you for having us.
Thank you. So before we get started, I would like to explain a little bit more about what you both do for a living and the assistance that you offer patients. Sadie, let's start with you. Can you tell us, what does an independent health insurance broker do?
Absolutely. So we assist with enrollments, and we each have our different specialty areas. So when we talk about an independent health broker, a broker might specialize in certain things. Our Wisconsin Health Insurance Advocacy has done a group insurance, small group insurance, ACA or Obamacare, and Medicare plans as well. So typically, and in best case scenario, an independent broker means that you're contracted with most of, if not all of the plans. There's some limitations. There are companies that just won't contract with agents. But ideally, you're contracted with as many plans as you reasonably can be so that you're providing comparison for people, and then you help them actually complete the enrollment.
And we get a lot of questions at Contact 6 that go into the nitty-gritty of healthcare plans, so I am happy that you are here today. And next, Debbie, can you tell us what it means to be a patient advocate?
Yes, I am also independent. I'm a board-certified patient advocate, and my firm, Patient Care Partners, focuses on nursing advocacy and high-level case management advocacy. We are independent of any healthcare system or any insurance company or any federal or state benefit. So we work directly for the folks who are hiring us. And those are, in almost all cases, patients and families.
And you've been a resource for Contact 6 before, so it is nice to see you again.
Thank you.
We are going to get to your viewer questions in just a moment. First, I want to thank everyone who took the time to fill out our online form. A couple of notes: we did paraphrase some questions that were on the longer side or that we thought needed clarity. And also, Debbie and Sadie will do their best to answer your questions today based on the information we have. But for more advice about a specific situation, you may want to seek guidance from an insurance broker or a patient advocate directly. But first, I'm ready to get to these questions. Reading our questions for us today is our Contact 6 associate producer, Annette. Annette, what is our first question?
Yeah, Jenna, our first question comes from Hannah in Kenosha. She says, I see a specialist physician. This service requires a urine sample be taken at his office every 3 months and is sent to the lab. The physician is in network, but the lab is out of network. I have no say or control regarding which lab is used. This has resulted in excessive out-of-pocket bills. Is there anything I can do?
Right. So the question here being, how can I avoid out-of-network lab charges? This feels like something that shouldn't happen, but it does. Debbie?
It does. I would argue that, first of all, this is a great question. And I would argue that Hannah has more power than she thinks she does.
Okay.
I would encourage her to ask the clinic, first of all, are you sending these out of network? This is what is in my network. So she would want to find out through her insurance company what is in network, and really ask the question, why aren't you sending these within my own network? Occasionally, we have seen some clinics have kind of preferred relationships with labs. That's not really okay. They are serving the patient, and she has the right to ask about this, certainly. And if they still continue to send it out of network, I would certainly contact our insurance company and file a complaint.
Okay. Would she ever need to switch physicians if it gets to that point? Would she ever get to that
I hope
point?
It wouldn't come to that. I would expect that they would work with her. Mm-hmm. She shouldn't be paying out of network for this. If there are labs within her network that the physician can use.
Yeah, I think about the No Surprises Act. Would that apply to something like this?
Yes, it would.
Okay. So she could reference that when talking to them, saying
Absolutely.
the No Surprises Act says I should be able to have an
That's right.
in-network lab.
That's right.
All right, great. Thank you. Annette, I think we are ready for question number 2.
Sure. So our next question comes from Michael in Mount Pleasant, and he tells us, I'm a 73-year-old man. I have not been to the doctor for over 2 years because the last time I went, they posted erroneous information to my chart regarding my visit. I sent them several letters to try to get the record corrected, but they refused. I was angry and lost trust in the medical system. The question here is, how do I make a correction to my medical record?
This is a sad situation for Michael because I hate to think someone who's 73-year-old is not seeing a doctor regularly. Debbie, this seems to play to your strengths again. What would you recommend for Michael?
This is a really good question. First of all, I would like to have a little more information about exactly what the error is. I mean, is it an incorrect birth date? Is it a misspelling of his name? Or is it something more serious like a wrong diagnosis or an inaccurate treatment plan? By and large, our healthcare systems are willing to correct mistakes. In some instances, unfortunately, patients will not be happy with what their healthcare team tells them, and they will take it upon themselves to do their own internet research. This makes healthcare teams crazy, honestly. So that would be another question I would have. Generally speaking, if a trained and qualified and licensed physician is saying X and patient is saying Y, we would have to weigh on what the physician is saying because they have licenses to protect.
Right. So it can be difficult when the patient maybe doesn't like the diagnosis or agree with it. It still has to stay on the record.
It does. And, as patient advocates, we can certainly help the patient understand, okay, this is your diagnosis, this is your prognosis, these are the likely treatment plans that are being offered, so we can help them make a best decision for, they're making the best decision and having informed information to do so.
Right. And if it is a legitimate error, that can have real consequences. Like, let's say they have allergy information incorrect on your
Absolutely.
record. So you should try to fix those things, right?
Absolutely. In fact, just today, I heard from, we are supporting a patient who's in the hospital. Her healthcare power of attorney was activated, but then that was revoked. However, that is not reflected in her medical record. That's really serious. So we are following up today to say, hey, hospital, you actually revoked this the last time she was here. This really needs to be fixed because that could have all kinds of negative consequences if that is not acknowledged.
Right. And if they're not getting acknowledged, is that where they have to turn to someone like you? Or what do you do if you're just calling and calling and you're not getting anywhere?
It's, so many of the things that we deal with become very tedious to people. And we often hear that folks, they don't quite understand how to get through this bridge. So we take their hands and we help them. And it honestly takes good clinical knowledge. It takes an understanding of how systems work, and it takes patience, really.
Right. And you can always try Contact 6 too. I'll throw that pitch in there as well. Annette, what do we have for our next question?
Sure. Our next question comes from Kate in Milwaukee. She would like to know, what documentation can a flexible spending account, an FSA, request as proof the funds are necessary? I feel uncomfortable disclosing health information with a company that is not a hospital or an insurance company. Does an FSA have the right to ask for personal details about why I'm choosing to spend money in my FSA account? So the question here is, what documentation is required to verify the eligibility of an FSA request?
All right, this is where I'm glad Sadie is here because we get questions like this from time to time, and we're not experts on FSAs or how they work. What advice would you have for Kate?
So the quick answer is yes, they do have the right to request documentation. So FSAs, HSAs, HRAs are all governed by federal rules, and those can be found on the IRS website, and they have clear categories and rules for documentation. I totally understand the privacy concerns. That is something you can always approach the company, the FSA third-party administrator, with questions about their privacy policy, find out how they keep your information confidential. If they sell that information for any reason or any portions of that information, and ask if you can limit it, if that is your concern. And then the other part I would mention is that typically FSAs, HSAs, HRAs, and this is a general statement, if the employer has more than 40 employees, those are covered by HIPAA privacy laws. So this may be something that she wants to investigate a little bit more by calling the FSA company and asking some of these critical questions. I think, in my opinion, having worked in this field and done some of this, your information is as secure as anywhere else online that you're giving confidentially. So asking those questions of the company may put her mind at ease too about what her concerns are.
You mentioned so many acronyms there, the FSA,
excuse
the
me.
HSA. No, but I think people get confused and overwhelmed sometimes when they have all these different options. How do you go about choosing what you should be doing?
Yeah, great. So typically your employer chooses for you what is available, and then you can choose to enroll in it or not and put money towards it or not. So FSA is a flexible spending account that can be applied more broadly often than an HRA or HSA, which I'll get to next. So there will be a list of things that qualify, and the FSA is really important to know is it's use it or lose it by the end of the year. So you just need to be careful with how much you're putting in, determine if your employer has a match, and then try to use that by the end of the year. Check that list, because there are often things on that list that are not direct medical care. That might be some over-the-counter items, or sometimes even gym membership or therapies that are beyond our medical system. So check that out. An HRA is a health reimbursement account, and that is a system where your employer, and it's exclusively employer, is setting up funds for you to go buy your own insurance. It's also often called an ICHRA. You can have an HSA where you're not buying the insurance, and that's an HRA where you're not buying insurance. And that's very similar to an HSA, which is a health savings account. That is a plan you can only have with a qualified high deductible health plan. And it's very important to look at those documents. This is whether you buy it yourself or through an employer, because even though a plan may have a high deductible, it may not be a qualified high deductible health plan. So it's very important to look at those documents before you make that choice. And an HSA, much like an HRA, is a little different because that is not use it or lose it. That rolls over year to year, and typically you can take it with you when you leave an employer.
Okay, thank you so much for that overview. Annette, I think our question next is from David.
Yes, David's from Racine. He would like to know, why are people on a limited income being forced to pay premiums for Medicaid? He says, I had to decide whether I wanted health care or food since this started up. Can you tell us, why are there new Medicaid premiums?
So which one of you would like to tackle this, the premium issue with Medicaid? Did they go away for a while and then they came back? What happened here?
I can start.
Okay.
So Medicaid is a state program, so it benefits from state to state. These are federally approved funds within the Medicaid system. There are a number of Medicaid programs in Wisconsin, and they all have varying costs. Now I'm going to pass it to Sadie.
Yeah.
Yes. So we have a wide variety of Medicaid programs in Wisconsin, depending on certain income and other eligibility criteria. For example, like, are you officially determined disabled? And various programs do have premiums. Some do not. Typically, we're seeing this as of this year, releasing of those premiums to be paid again. They were paused because of COVID during the federal pause on all of that. So that's the reason that for a long time people didn't pay Medicaid premiums, even though they may by state law, as Debbie was saying, have technically been required, but it was on a freeze. So there is a sliding scale. It's based on program and your income. That's who pays it. They determine based on your income what your premium will be. And you may also want to contact Medicaid. You can do that through the consortium where you live, or in Milwaukee County, it's Milwaukee Enrollment Services, and just determine if there's any deductions maybe that you could be taking. Oftentimes, it varies by program, but oftentimes there's deductions for medical. If you have other outside medical expenses or bills that you're paying on, you can often use that to show that technically your income is a little bit lower. So I encourage this person and anyone on Medicaid struggling to pay a premium to contact their consortium or Milwaukee Enrollment Services if they live in Milwaukee County.
Right. And I hope that David can find the help he needs, because I hate to think someone is going out without health care. Yeah, Debbie.
This is a great opportunity to contact your elected state representatives if this is an issue for you, because by and large, our elected reps they're very accessible. And I do believe that by and large, they are very interested in hearing issues that their constituents have. So this would be a great topic to bring to your state official if
Right.
it's of concern.
And even if you think, oh, it's just one person, other people might be having that
Absolutely.
issue too. And if they're getting a ton of these complaints, that would
That's
flag
right.
their attention. All right. Annette, who do we have next?
Next, we have Carol. She says, I have top health insurance coverage, and I'm told because I have not been in the fund for 12 months, my procedure is not covered. It is classified as pre-existing, even though I didn't know I had the condition when I joined. She asks, is this correct? So the question here is, when can health insurance deny coverage for a pre-existing condition?
Right. So can a condition be pre-existing if you didn't know you had it before? What do you think might be going on here? I'll let either of you jump in.
Yes, it can be depending on your insurance. So with the Affordable Care Act, when that was fully implemented in 2014, there are now Affordable Care Act compliant plans and short-term plans. And then there are also some self-funded plans through employers that are not Affordable Care Act compliant. So this could happen. That signals to me that this person, Lisa, is either in a... Is it Lisa? Excuse me,
Carol.
I'm sorry.
Lisa's next. We'll get to her.
That makes me think that Carol is either with an employer plan that is so old or self-funded that it is not technically Affordable Care Act compliant. That I think is a very unlikely scenario. The most likely scenario here is that she has purchased a short-term plan and it's not technically full insurance. So that can happen. And yes, their plan documents, it varies by plan. You want to be very, very careful about reading the terms and conditions before you sign up for any plan. They can discriminate for pre-existing conditions both in enrollment and once you are a member. And there's wide variation in exactly how they do that. But that's a really typical one, especially if the condition is something that you would have had before, even if you didn't know about it.
Right. And the financial consequences can be huge for something like that. Debbie, is there anything you want to add?
No, the only thing that really struck me about this question was in the very first sentence, she mentions a health insurance coverage, and then she mentions a fund. So I wondered, which is it?
Right.
Because those are two very different things.
Okay. Right.
If I could jump in, thank you, Debbie, for reminding me. Yes, the other option is she may have purchased a health sharing ministry. These are typically religious organizations. They are not insurance plans. They make it very clear that they're not insurance plans, and they have a lot of limitations when it comes to pre-existing condition, preventive care, maternity care. So again, before you're purchasing any plan, it is very important that you're careful to read the terms and conditions and the coverage of the plan and see whether or not that's Affordable Care Act compliant and if you want to go that route.
Right. Thank you, Sadie. Annette, I think we're ready for another question.
Lisa is from Pleasant Prairie. Lisa tells us, I'm looking for decent health care in my early retirement. I called the Obamacare website and they hooked me up with Healthcare 360, a division of Aetna. But the cards came and it says it's not insurance. It's hard to trust the coverage. We are over 60 and in good health, but need insurance in case of an emergency. How can I tell if my health care is legitimate?
All right, Sadie, I think this seems like a question for you because when Annette and I get a question like this, we don't know enough about every different option out there. So I'm glad you can offer us some insight on Lisa's situation.
Absolutely. So healthcare.gov is the official Affordable Care Act website. There is not an Obamacare.com that is linked to the federal government. So if you are going to a website, make sure that it's .gov, not .com at the end of that if you are wanting to check plans. So this has some really big red flags for me.
Okay.
If this person did call the official healthcare.gov line and they received this bad information, that really needs to be researched and reported because that's a really serious violation. for the federal government worker who did that, all of those calls are recorded. So this would be something easy to track. My instinct here is that Lisa called a number that she found that looked like an official government website. And you do have to be careful with those websites that are trying to capture your information when you're looking for actual legitimate healthcare or the actual legitimate government site. They often make it look a lot like the official one, and then they capture your information to send it to telebrokers. So these are people throughout the country or potentially the world who do telesales, essentially. I really encourage Lisa and anyone else to find a local broker, one who works with, again, multiple or all plans as is reasonable, and someone that, even if you're not meeting the person in the location, we're in open enrollment now until December 15th. So all brokers are really busy. Almost all of us, because of how the system is now set up, we have to do a by phone appointment. But a local broker would be there for you throughout the year when you have problems, billing issues. And we often get a backdoor too to resolve problems. Covering Wisconsin, which is part of the UW system, has a list of local qualified brokers who work with it's typically all plans in Milwaukee that you have to show because it's focused on that. It used to be the Milwaukee Enrollment Network. But you can visit coveringwisconsin.org and find that list of brokers that they have vetted.
You mentioned red flags. You said the cards came and it says it's not insurance. Should that ever happen? I mean, if you're going to healthcare.gov, you should only be getting insurance, right?
Absolutely. This is 100% a short-term plan. So she got routed somewhere that was selling a short-term plan that is not full insurance. You can also, on the Covering Wisconsin website, they provide a great chart of the plans that actually do provide full Affordable Care Act insurance in Wisconsin. So if that name, the insurance company name, is not on that list, or it's not quite a fit, then you really need to be doing some more research before you sign up. Because a lot of the big insurance companies are doing short-term plans, and some are even doing Affordable Care Act plans. So we want to be careful that it's the right division. And again, a local broker can help you determine that. And a local broker too has an obligation to tell you if the plan that they are attempting to sell you is a short-term plan or a full insurance plan.
That's really interesting. All right. What do we have next?
Next, we have a question from Rothia in Milwaukee. She says, I have a medical bill from a hospital that was sent to collections because I was unable to make the final payment. I then forgot about it. A few years later, I attempted to pay the bill, and the law firm said they no longer have the contract with the hospital. I contacted the hospital, and it wrote me a letter stating it was waiving the balance because it could not locate it. In the meantime, the case went to court, and the judge said I need an affidavit stating the payment was satisfied. I tried contacting the hospital, but got no help. Now I have a judgment on my name that I cannot pay and cannot get removed. Who can I contact for an affidavit if the hospital will not communicate with me? So the question here is, who can help me with an unpaid hospital balance in court?
All right. There's a lot that goes into this question that I would like to talk about, because we do hear a lot about issues with medical bills going to collections, and that's a whole other thing. I guess we could start with how do we handle this when it's already in court and there's already a judgment?
That's right. In my opinion, since she's already gone to court and the judge has said, I will not accept the letter from the hospital, I need an affidavit, that tells me that she needs good legal representation. I'm wondering if she's talked to an attorney. She might also turn to the Legal Aid Society or Legal Action in Wisconsin,
Which provide
for
free
help.
legal aid.
Exactly. But this is so far down the road that it's really difficult to comment on this.
Right.
There's a lot there.
Let's say we weren't so far down the road and someone gets a collections notice. How do you recommend they handle that? Should they call the hospital to try to talk about it? Should they pay it? And then any advice when it comes to collection notices, either of you?
Yes. We always tell, and we don't do a lot of medical billing cases, but I always encourage folks at any cost, don't let it go to collections. Pay what you can, communicate with the billing office as often as you're able to. I do believe billing offices want to work with patients and families. And if they don't hear from the families, it will eventually go into collections. And unfortunately, then you lose all your negotiation power.
Right. And you would hate to have something hurt your credit over a $20 copay or
Yes.
something like that you
Yes.
just lost track of. All right. What is our next question?
Our next question comes from Jerry in Port Washington. Jerry says, my husband passed away on April 22nd of 2024. He had long-term disability with a financial group. I called them to let them know he had passed, and they sent me his final checks, but dated them April 22nd, so I could not cash them. They refused to make the checks out to me, so they could not be cashed. They owe me the money, but will not work with me. I'm out over $1,400. How do I get my late husband's final disability checks?
So, Debbie, I think you said you could answer this one for us.
Yeah. First, I'm sorry, Jerry, for the loss of your husband. This is interesting because, as I understand it, Jerry does have the checks. They are made out appropriately so to her husband because he was the policyholder. I am wondering if Jerry has gone to their bank with her husband's death certificate in hand saying, can you help me with this? If not, this would actually be part of her husband's estate, her late husband's estate, which would need to go through probate. So I'm wondering, again, if she's working with a lawyer on that. Hopefully the bank would work with her and this could be an easy fix.
But would she be entitled to that last check?
I believe so. It's part of his estate.
Right. Okay.
These are part of his benefits.
Okay. All good questions to ask. Did you have anything to add, Sadie?
I do, yeah. And I think is it owed or not depends a bit on the policy, how the policy is written. So some policies due through the end of the month when a person passed, a month over on the date of their passing. So that would be a question for the insurance company in reviewing that policy. The other tidbit I have is it is really important for any of these issues we've discussed to call the companies in question and ask them some questions. Do your best to stay calm. It's not awesome to do when you are in the immediate throes of grief. Try to think through some questions that you can ask in advance and write them down. And oftentimes, if you treat that representative that you get on the phone, who is rarely a decision maker, if you treat them as if they're your friend, and you're asking questions and asking them to help you without begging, and treating them with like collegial respect and that they will help you, you can get a lot of information. And oftentimes it doesn't even need to be something on your record. You can just ask questions about why things are and what might happen. So the other thing I might suggest is calling the insurance company and asking general questions about how long was the policy supposed to pay out for? What happens if those checks aren't cashed? Are they reissued with a new date? What is the survivor or beneficiary policy on the insurance? That's probably going to be a big part of it, as if the insurance had a beneficiary, which not all types of disability insurance do, she may have a right to have that handled differently. So call them and ask.
All right. I appreciate all those follow-up questions for her. Now we're going to move on to some questions from our Contact 6 case files. These are issues that we hear about quite a bit at our segment. Annette, what is our first one?
So Contact 6 often hears from consumers about medical billing concerns. Sometimes their bills were coded incorrectly. Other times they say their claims were denied because of incomplete documentation, incorrect patient information, or missing information. What advice do you have for a patient who believes their medical bill is incorrect?
All right, we do know that medical billing issues happen. Sorry, Annette, I cut you off. The question here is, how do I fight a medical billing mistake? What advice would you have people they're just starting down this process?
You absolutely hit it on the head, Sadie, when you said be polite to the person who took your call. This takes a lot of persistence, it takes patience, it takes politeness, and it takes really good documentation. You want to make notes of who you talked to, what the date, what the time of day was. The No Surprise Act, which was passed in 2022, has helped with this. But still, more than half of medical statements will have errors on them. Medical billing departments will work with you to correct errors. But again, they are dealing with such a huge volume of cases, it's going to take time. It just is.
And it can be frustrating when you're starting over with a new person every time you call. So that
Yes.
patience is hard, but it is necessary. And you do have rights in this process. You can appeal.
Absolutely. You do have rights. One thing that I would like to point out is that we often work with folks who have long-term care insurance policies. So often even though they've been paying into these policies for years, if not decades, they don't really understand what their benefits are. So we help them understand, okay, this is kind of the pot of money that you have to pay for your care. The trick is to figuring out, when do you initiate that claim process? And believe me, these insurance companies do not want to hear from you. They don't.
Okay.
They just don't. So sometimes they will automatically deny the claim, hoping that you'll go away. Again, that takes persistence and politeness and good documentation. But it is a crack that you can code, or a code that you can crack. And, when we get it figured out and those checks are rolling in on a monthly basis to pay for long-term care, that's a beautiful thing.
So Sadie, I'm also interested in your perspective on just how do you fight a medical billing issue?
Yeah, and great things Debbie has shared. Debbie and I work on different phases of this issue.
That's
So
right.
I, as a broker and a good local independent broker, would be working on the first half of this
That's
issue
right.
as we're dealing with claims, the hospital rebilling coding. And then if that doesn't get resolved, that's someone like Debbie can help take over the case. So this is something that I do very often in work and have done over more than the last decade. So several tips for you. First of all, the most important thing to know is that insurance is like a computer. It's like the coding on a computer. If the right data is not sent and input, it's an automatic denial. The insurance company and the representatives tend to have no power to make adjustments. I'm not saying they shouldn't have power, but they don't have power to make those adjustments based on what you're saying. So I would say most of the time it's about returning to the hospital, often to your direct provider, and asking for a review and recoding. And oftentimes providers need a bit of nudging. I can use myself as an example. I had a vitamin D test, and it was like a $330 bill. And we went back and forth for a year.
Wow.
And I stuck with it. And I think that's the most important thing. And to very much echo what Debbie said, it's about persistence and calm. And I would really encourage people to, if they have a bill and they're starting to get collection threats, to call the hospital system and ask them to freeze. Most hospital systems will do a 30-day freeze, especially if you say, with the purpose of, I am still dealing with this with insurance. It's still in dispute. Most of the time, we can have them freeze up to a year. You just tend to have to do it in 30-day segments. That gives us time before it's truly in or that close to collections, where all of a sudden it becomes a consumer debt and we can't deal with insurance. And again, that tends to be outside of a broker's control. I would also really encourage people, when you use a local broker for your insurance, we have backdoors to the company. So for our clients, we do typically deal with billing issues, and I'm dealing with that right now. And I have a more direct contact to the company than just calling the 1-800 number. And we can often try to figure these things out, request records, get more information from the insurance company than an individual member could do. So at Wisconsin Health Insurance Advocate, we do that. Most brokers are providing at least some basic advice on how to do that as well.
And you can appeal, I think, twice, right? Or is it 3 times? You can appeal more than once. Even if you're denied on appeal, you can try again.
It's critically important to exercise your appeal rights. It is so important when you get an explanation of benefits from your insurance company to note what those appeal rights are, ask for help, do a little bit of research, and then when you're getting close to that deadline, submitting an appeal. And that often keeps your rights active. So yes, that's absolutely true. It depends on the reason for the denial and the insurance company, exactly how many you get. But yes, typically you get at least 2 appeal.
All right. And I know our next question has to do with medical billing as well.
It does.
What do we have?
Yeah, so over the last year or so, a handful of people have written to Contact 6 about medical bills that arrived more than 1 year after their patient visit. When they called their medical providers, some were told their bills were being waived because the billing period had lapsed. Others were told the bill was still due. Is it ever too late for a hospital or clinic to send a bill? So the question being, when is it too late for a provider to send a bill?
So Contact 6 has resolved some of these issues when we reach out to hospital systems, insurance companies. But I didn't know, is that the general practice, or were they just doing it because we reached out? I'm interested in your thoughts about the timeline in which you're allowed to send a bill to someone.
Yeah, wonderful question. Typically, especially in the most egregious cases, media can be a huge help and resource in advocating for consumer rights, especially because you tend to get different people responding
Sure.
to you than
We get to skip through the customer service and go to the top.
Yeah. So for the most part, it varies. The answer varies based on the kind of insurance that you have. Medicaid, for example, is a 1-year period. And outside of that, there are rules about whether or not doctors can bill you. So it varies by the insurance that you have. Insurance companies, especially if you have private insurance, are concerned about the contracts they have with providers. When you have insurance, there's a contract between you and the insurance company, and a contract between the insurance company and their network of providers. So if those providers are not following the rules of the contract, which also violates your part of the contract with the insurance company, they need to know about it. The other suggestion I have is, if you are stuck on anything with the insurance company, filing a complaint with the Office of the Commissioner of Insurance can also be a bit of a help. Varies by issue, but typically that's a good place to start, because if they can resolve the issue, it can end there. And then if they can't, you can take it a little bit further. And then I would also mention to you, both for this case and previous cases, the Department of Financial Institutions is the one who, very lightly in my opinion, regulates hospital systems and billing. So that's also a place that you can file a complaint. And sometimes even just getting a complaint on the record, especially if you need to take it farther legally, is a good idea.
Debbie, is there anything you'd like to say about this that Sadie hasn't covered?
No, I think that's great. Well, actually, there is one thing I would like to say. We are all healthcare consumers, and I think it's very important that we all are aware that we have rights, and sometimes we will need to reach out to professionals to help us, and there is help available. So I think it's important for us to remember that we're all consumers.
Right. All right, Annette, what is our next question? We're getting toward the end here, just a couple
We have
left.
Just a couple left. Contact 6 often hears from people with complaints about nursing homes. We hear that people aren't happy with the care their loved one is receiving, and some even call the facilities negligent or unqualified. Others accuse faculty staff of stealing from their loved ones. How can families choose a safe nursing home for a loved one that ensures the best quality care at a price they can afford?
All right, so the question coming down to, how do I choose a nursing home for a loved one? This is such an important question,
It's
and I'm glad
so
we're talking
important.
about it. Where do they start, Debbie?
It is so important. And there's a few levels to this, but I will try to break this down into bite-sized pieces. The first thing I think folks need to understand is there are different levels of care. So there are above 55 apartments. There is assisted living. There's short-term rehab. There's long-term rehab. There's skilled nursing homes. There are memory care. There's long-term acute care. There's all kinds of
It's a lot to
levels.
think about.
It's a
Okay.
lot to think about. So you have to understand that. Folks, also, we spend quite a bit of time educating families on, how does this get paid for? The general rule is that Medicare, for those over 65, will pay for hospitalizations and short-term rehab, but long-term care is generally the responsibility of the patient and families.
Okay.
There are some ways that we can help with that, but that's a different question.
Okay.
Next, it is very, very vitally important that you understand the clinical needs of the patient. So often we are working with hospital discharge planners or clinics in providing additional information about the patient so that we can get them appropriately placed, so they are really set up to succeed. Sadly, there are many, many issues with care facilities. There is a way to look up their ratings. You can go through the DHS website to look up how the state has rated care facilities. What we see very often is staffing shortages, and that is across the state, across the country. It's a very big problem, in my opinion. Also, we see that there's just not enough help.
Right.
for our patients to get what they need. This is where a private patient advocate is worth their weight in gold. And I mean that so sincerely, because we can understand the clinical needs, what the plan of care is, which is key. What is the plan of care that is set up? Because then we want to make sure that plan of care is being followed. And that's a lot of accountability. It's a lot of keeping our eyes out on things, our eyes open to things. Because we want to make sure that the patient is getting what they agreed to when they entered this care facility. So it's very complex, and it's very sad when you hear about things like this, and it happens, and you have to be very vigilant.
Right. And I'm sure everyone would love to say money is not an issue when you're taking care of my parents or my grandparents, but it is.
It is. This gets very expensive.
Yeah, it
very,
does.
very expensive. And it comes across all social norms, but people will turn to us and say, what if we're doing this for 10 years, for 20 years? What do we do? In that case, we can refer to an elder attorney that might be able to help with some spend down processes to help the patient apply for Medicaid. It's not something that we can help with, but your county ADRC, the Aging and Disability Resources Center, can help with that. Or you might want to specifically work with an elder attorney that can help patients lawfully hang on to assets while applying for this process.
For someone who's in a bad position, they're unhappy with the care their parent is getting. It's a lot of work to move someone to a new facility. Can they do that? Are there time periods in which they have to? Is it like renting an apartment? You have to do it at certain times?
It depends on the agreement that you reached with the facility when you entered their care. But hopefully it doesn't get to that point, and
Right.
that's where we can help, quite honestly. And you also have to think of the patient, because it can be very disruptive for a patient to move to a new facility, and it can actually set them back medically. So you really want to think about that before that's your option, your best option.
Let's say you're visiting the facility before you go there. What should you be looking for?
Oh, so many things. You should be asking about their staffing ratio. You should be asking, you just want to generally, is the place clean? Do the employees look happy? How is the food? That is an amazingly important thing. Are the employees there long term? Do they appear to be happy in their jobs?
Right.
Are the residents appearing to be happy? Are the residents engaged on a daily basis with activities? Of course, it depends on what the level of care is here, but in general, you really want to kind of be like a hound dog sniffing those things out.
All right. And I think we have one more question. Annette, what do we have?
The last one. Complaints to Contact 6 about out-of-network balance bills have dropped dramatically since the No Surprises Act went into effect in 2022. The consumer law offers broad protections from out-of-network balance billing, for example, receiving out-of-network lab services at an otherwise in-network facility. However, we occasionally still get complaints about out-of-network bills. In most cases, the complaints are about ground ambulance rides. Under what circumstances might out-of-network balance billing still occur?
So yes, I'll be open and say we're working on another report about ground ambulance rides and the balance billing issue there. But what kind of circumstances might we still get an out-of-network balance bill?
Thank you. Yes, that's really significant. The No Surprises Act is quite narrow. It filled a very important gap where people were receiving care typically in a hospital setting and in an emergency setting from out-of-network providers that they did not consent. Debbie and I had chatted a little bit about, we both see it typical from anesthesiologists. You're in an emergency situation, they bring in an anesthesiologist to put you under, you likely aren't even meeting this person except for that second, or you're unconscious. So the No Surprises Act filled that gap, which was really critically important, but it didn't fill a lot of other gaps where we're experiencing in and out of network problems. So ambulance is one of those things. As Debbie had mentioned before, it is really important to contact your lawmakers, and this could be state lawmakers and federal lawmakers, because this does require a legal change. I typically say insurance companies will, and hospitals will do what they are legally required to do, and they typically don't go beyond that. They may in service, but as far as like actual benefits, they tend not to. So use your appeal rights. You can file a complaint with the No Surprises Act through healthcare.gov. And if you Google No Surprises Act, it may in fact be nosurprisesact.gov. Again, make sure you're on a .gov for this. You can file a complaint with the Officer of the Commissioner of Insurance. And you can also potentially file a complaint with Department of Financial Institutions and the Department of Professional Services as well. I often see this. I had one earlier this year. They are incredibly difficult and difficult to fight, especially if time lapses and your appeal rights have lapsed. So I typically encourage people as we're dealing with this to always file an appeal, and we typically file that appeal pretty close to the appeal deadline. That gives us time to contact the provider, see about recoding or negotiation or what they might be able to do. And then I'll also mention there are certain kinds of insurance where you're not allowed to balance bill. And if you do balance bill, you need to, or as out of network or balance billing, you need to have the patient sign a form authorizing it. So if you are being given a consent form, or if you're on Medicare, that's an advanced beneficiary notice, that is your big red flag. They don't typically do it for ambulances because it's waived during an emergency, but use your appeal rights, use your complaint rights, use media if you need to, and get to the bottom of why this is happening.
So if you get an out-of-network bill at an in-network facility, for any reason that shouldn't be happening, you should fight it unless you've waived your right?
It varies a lot by the service that you received and how you were classified in the hospital. Generally, I can just say the No Surprises Act attempted to cover emergency care and inpatient in-hospital care. There's some rules for ambulatory surgical centers as well, especially when you don't have control. So there's huge variation in the service you received and how you were coded when you came in.
Well, thank you so much for this discussion with us today. I found it really helpful and informational, and I hope our viewers did too. Annette is nodding over there. We always enjoy these segments. We learn a lot. That is all the time we have for today. If you would like to submit a question for a future Ask Contact 6 segment, you can go to our website, fox6now.com. There's a blue button on the right side of the screen that says Ask Contact 6. You just click on that. You can fill out a form and find out what topic we're choosing for the next time around. Debbie and Sadie, thank you so much for being here today.
Thank you.
Oh, of course. Thank you also to the people who make this recording possible, including our executive producer, Sarah Smith, Craig Sween in graphics, our chief photojournalist, Kale Zimney, and our editor, Dave Machuda, who is also working the video switcher today. I'm Jenna Sachs. Thanks for joining us.